Hi everyone, welcome back to your next presentation. Now this one is looking at the safety and effectiveness of exercise in systemic lupus erythematosus. These are your two learning outcomes for this particular presentation. I'll be focusing on safe and effective exercise testing and safe and effective exercise prescription for people with systemic lupus erythematosus. Now, firstly, I just wanted to outline some of the more common outcomes that are used in people with systemic lupus. Now, this is not an exhaustive list. These are just some of the more common ones that are used. Disease activity is something that I'll show you what that looks like. Fatigue, quality of life or functional status, aerobic capacity, and of course, muscular strength and endurance, depending on what the particular intervention was. Now, if we start with disease activity, this is a very common scoring sheet that's used. It's called the Selena-SLEDAI. Now, I just want to note that this assessment can only be performed by a medical practitioner. So unfortunately, we can't administer this one as exercise physiologists. But normally, if you are seeing someone and they've been referred to you by their rheumatologist or immunologist or general practitioner, you will have some indication on what their disease activity is. Now, I presented in the other presentation something similar where I went through the different descriptors or symptoms that the person is undergoing at this present time. So things like, if you look at the list, seizure, psychosis, organic brain syndrome, visual disturbance, and the list goes on. And as you can see, there's a weighting for each particular symptom or manifestation. So depending on what the person scores will show their disease activity, and you get a total score. Now, what do the scores actually mean? So if someone has no disease activity, so they're in that state of what I mentioned in the other presentation, remission, then they will have a score of 0. It means they have no active symptoms at the moment. Mild activity is a score ranging from 1 to 5. So you can see in that list the ones below that are weighing about 1, 2, or 4, they'll only have either a couple of those or one of the 4 scores. Moderate activity is 6 to 10, high activity 11 to 19, and very high is over 20. So when we talk about safety and effectiveness of exercise interventions, I just want to point out that the 2 systematic reviews that I'm about to present were all on patients with mild and moderate disease activity. So we don't actually have data for people with high or very high disease activity. And you can imagine why. And when it comes to clinical research trials, it's a lot easier to disregard those patients because they're a higher risk category. So just keep in mind that we're talking about people with mild to moderate disease activity. Now, if we look at fatigue, these are some common fatigue scales, and this study was done in 2020, and it looked at the practical management of fatigue and how we can assess that. So the fatigue severity scale, which is something you might have heard about for other diseases. The multi-dimensional fatigue inventory, or MFI, VAS for fatigue is also used. And then the bottom one, the functional assessment of chronic illness therapy fatigue, or FACIT fatigue, is something that I'll show you what that actually looks like. And it's something that I'm more familiar with, and it's now being more commonly used for people with systemic lupus. I just want you to know that in the description here, it does say 13 item. That's the shortened version of the FACIT fatigue. What I'm going to show you is the long 40 item questionnaire. All right, now this is the FACIT fatigue. And as I mentioned, this is the long version of FACIT fatigue. The first 2 subscales is physical well-being and social family well-being. The next 2 is emotional well-being and functional well-being. And then the last part is additional concerns. Now, when you talk about FACIT fatigue, the 13 item scale, they just use these 13 questions that are listed in the additional concerns. However, if you go for the full 40 item questionnaire, then it's all of those subscales that I showed you. Now, in terms of scoring the FACIT fatigue, there's a little bit of a system here, and you can see just this sheet that I've just screenshot for you. You get the score and you place it in the number lines there, and you follow the instructions. So some say 4 minus or 4 plus, and then you get your item score. And that will give you a score or a total score for each of those subscales. And then you can also get a total FACIT fatigue score. And I just want to point out that the higher the score, the better the quality of life and fatigue. So you want patients to be scoring a higher number. So if you see a reduction in their score, usually indicates that they're feeling more fatigued than normal. So you want to see the higher the score for facet fatigue. Now, quality of life, SF36 questionnaire. I'm sure most of you have heard about this one before. This version that I'm presenting to you is called the RAND version. The good thing about this one is it's really clear. There's a website that you can go to and it explains how to use it and how to score it. Scoring is usually the hardest part about the SF36 and nobody really talks about it too much. As you can see here, I've just screenshot 2 questions of it. And you can see in general, what would you say your health is? And it's a number system, 1 being excellent, 5 being poor. Now, just take note that the SF36, there's 36 questions, as the name indicates, but the Likert scale for each of the different questions changes throughout it. So this one you can see it's 5, whereas other ones are slightly different. And I think there's some true and false and things like that in there. So it changes throughout the 36 questions. So scoring it is quite challenging because you have to follow explicit instructions. And if you go to the RAND website, it shows you exactly how to score it. So it's in 2 steps and you follow the steps. Each number represents a different score. So 100 being 1 and then 5 representing 0. So then you calculate it and you get a number of, you get a score for each subscale. So the good thing about SF36 is you can break it down for the different subscales. So they might be experiencing poor quality of life in the category of energy or fatigue, but they might be reporting really well for, say, physical functioning. So it's good that it breaks it down into categories. It also does one extra step. It breaks down the mental component score and the physical component score. So you can see where their quality of life is potentially better or lacking based on the mental and physical components as well. Again, the instructions and how to score it is all on the RAND website. Now, this is that same study, MERTS 2020, and looking at a practical management of fatigue. So I thought this was quite good to present. If we're looking at management of fatigue and systemic lupus, always check for general non-lupus causes. So there might be other reasons why someone's feeling fatigue. It's always important to talk about with your patients the list of medications. Has anything changed? What's their lifestyle looking at? Look at their sleeping pattern, their food intake, vitamin D levels or supplements. And then we need to know, is there any presence of active disease? And that's that disease activity scoring sheet. We need to know, is there anything going on a lupus level? So, of course, it's the responsibility of the doctor at this point to control the disease activity if SLE or systemic lupus is the major cause of fatigue in this scenario. And then they need to really look for, major organ damage. Is something going on? Is there chronic pain? Is there psychological determinants here? We reassess fatigue. We try some targeted interventions. So physical activity and exercise is one of those targeted interventions. It's known to improve fatigue in patients with systemic lupus, and I'm going to present that data. So I thought it was great that they've actually indicated physical activity as one of those targeted interventions. Now, there's only 2 systematic reviews that have been done on systemic lupus and exercise. This is the first one. This was done in 2017. And what they found was overall 12 weeks aerobic exercise supervised by health professionals is a safe and effective way to reduce fatigue. This particular review really only focused on one outcome, and that was fatigue. However, what they did take note of is that the optimal exercise protocol still is yet to be identified. So we don't actually know exactly what type of exercise or how much exercise, but we know that exercise in general does help with fatigue. Now, in this particular review, there was 3 studies that were included, 2 of which had a randomized control design and 1 which was quasi-experimental. And of those 2 that were randomized, 1 study generated a score of 5 out of 10 in the PEDRO, which is looking at bias, so it wasn't particularly high. The other one scored a 4 out of 10. So if you look at the quality of the actual trials included, they're not too high in terms of quality. Fatigue and vitality. So vitality comes from the SF36. They were both analysed in all 3 studies. Now, what they did in this study, which I really liked, is they started to explore a little bit of the parameters of exercise. So they looked at the type of exercise training. And in this forest plot here, you can see that aerobic exercise, being the top section, The black diamond that you see is all the way over on the experimental side. So it showed a significant difference of between exercise and no exercise, and that exercise significantly improved fatigue outcome in people with systemic lupus. They found that relaxing exercise didn't really have a significant impact on fatigue. And overall, all of the interventions, aerobic and relaxing exercises, the black diamond right at the bottom shows that it had a significant difference there. So exercise, no matter what type, does improve fatigue, but aerobic exercise had more of an impact on improving fatigue. They also looked at the time of exercise training. So in the first one, that's 8 weeks, and they showed that there was no significant impact on fatigue. So the black diamond crosses over the line. Whereas when they did 12 weeks, so an extra 4 weeks, it had a significant impact on their fatigue. And overall, 8 or 12 weeks, as you can see, the black diamond at the bottom is all the way on the experimental side, which means sticking out an exercise intervention will improve your fatigue. But the longer you stick it out for, the better it's going to have, better impact it will have on your fatigue. And the last one was the setting of exercise training. So what they found here was that home-based exercise didn't have a significant impact on fatigue. It improved fatigue because you can see a lot of the line is on the experimental side, but the black diamond, which is really looking at the significant difference and looking at the quality of the design, there wasn't a significant difference on impact on fatigue. And when it looked at supervised exercise, there was a significant impact on fatigue. So supervised exercise, again, was superior to home-based exercise in this meta-analysis. But overall, the black diamond is all the way on the experimental side, which shows that home-based or supervised exercise improves fatigue. Supervised just is better. So I thought that was really interesting to present to you, and that's some of the data that's out there in lupus. Now, this is a screenshot of the characteristics of the studies included in this review. You can see there the 3 studies that were included, and each column there shows you a little bit more about each of those studies. So it's always good to look at this when you do look at systematic reviews. So it shows you the study design, and I already mentioned that 1 was quasi-experimental and 2 were randomized controlled trials. The PEDRO is looking at the quality of the study. So we can see 1 of them was not reported, and then 2 of them were 5 and 4 out of 10, which is considered poor or fair quality of study. It shows you the sample size of how many participants were included in the exercise intervention group and the control group. Or for the second one, there was also that relaxing group exercise in there as well. It shows you the average age of the participants, their disease history. It also shows you their disease activity score. And I mentioned earlier when I spoke about disease activity that most of the participants included in trials have a mild disease activity, and you can see there's scores of 1.15 and 1.75, which is really, really low disease activity. Now, the 2 studies below, it gives you a SLAM score. Now, SLAM is a different type of disease activity scoring measure. It's called the Systemic Lupus Activity Measure, and it's just a different way to score it. A score more than 6 indicates clinically important and therefore need medical treatment. So you can see that the participants were under 6, which again is considered quite low to mild disease activity. It shows you the adherence rate of the participants getting involved in the interventions. It shows you the fatigue instruments that were used, and we outlined some of those earlier. So fatigue severity scale, the vitality subscale and SF36, the Chalder fatigue scoring system, the VAS. So some of those that we've already outlined were used in these interventions. And then it tells you a little bit about the exercise protocol. So you can come back individually, take a look closely at the studies that were included in the review, and this can also help you base some of your exercise prescription that you use on some of your clients that you see. Okay, so what I did here was actually go and look at one of the individual studies that was included in the systematic review. This was done by Tench, and this was looking particularly at fatigue, and this was a randomized controlled trial. Now, these are the outcomes that were used. There was 8 outcomes, and this will help you when it comes to designing your exercise testing for your clients. And this is the exercise group intervention. So it's home-based, unsupervised. They were encouraged to perform exercise 3 times a week over 12 weeks. for 30 to 50 minutes, mostly aerobics or walking, cycling or swimming, and at 60% intensity. Now, if we look at the results of this study, these are the symptomatic measures in the groups at baseline and after the 12 weeks of intervention. I've highlighted the results for the exercise and the control group, so you can see the difference there. And the main outcome that was improved was fatigue. And fatigue was measured using the Chalder fatigue scale. And they found no significant differences between the two groups, between exercise, relaxation, and control for any other symptomatic measures. They also didn't find any significant difference for any of the other physiological measures. They did, however, find that there was an increase in exercise duration for those that were in the exercise group. So this was a second systematic review that looked at both exercise and physical activity in systemic lupus erythematosus. This study was done in 2017, so the same year as the previous one I presented. There was a total of 11 studies that were included in the qualitative synthesis, but only 7 studies were actually included in a meta-analysis. The methodological quality of included studies were mixed, with numerous domains unreported. 2 studies were deemed to have a low risk of bias. 5 were considered to have a high risk of bias, therefore the quality was considered lower, and 4 reports were actually unclear. So you can see that there was a mixed range of quality amongst all the 7 studies here. Now, in terms of the meta-analysis, they did it on 4 outcomes. So the 4 outcomes were disease activity, fatigue, aerobic capacity, and depression. And I'll present to you those forest plots now. And what they found was that exercise does not affect disease activity. It positively influences depression and lowers symptoms of fatigue when they compared it to control groups who did not participate in the exercise intervention. So this is the first forest plot that looked at disease activity. So we know what disease activity now is. So it's the weighting of different manifestations. So what they found when they did the disease activity scoring was that pre and post the intervention, there was no significant difference between the two. Now, if we look at that black diamond, it sits right on the line. So that shows that the exercise intervention didn't make disease activity better, but it also didn't make it worse. So I wouldn't look at this data as negative. It's actually a positive finding because it shows that exercise is considered safe and that it doesn't make disease activity worse, which is really important because sometimes there's a fear that exercise can make people worse, but this data actually shows that it doesn't impact disease activity. This second one looks at fatigue, and we can see that nice black diamond sitting right on the favors exercise side. So as exercise physiologists, we really like to see forest plots that look like that. So this shows that exercise does improve fatigue overall. Now, if you look at the studies that are on the side, you can see that there's not too many studies. Now, there's not a lot of trials on lupus, so that's why you can see only 2 studies were looked at in this particular example. But still, it's a positive finding here that it does improve fatigue. Now, this third one is looking at depression. And again, we can see that nice black diamond sitting way over the favors exercise side. So again, we can safely assume that exercise does help with feelings of depression. So people reported to be feeling better following an exercise intervention. Now, the last one here looks at aerobic capacity. And to no surprise, as exercise physiologists, we know that exercise should improve people's aerobic capacity. So we can see that exercise in these examples does improve aerobic capacity. So this just breaks down those 4 outcomes that were meta-analyzed in this systematic review. So here's just a screenshot of all of the 11 studies that were included in the systematic review. It's always a good idea to look at this when you do look at systematic reviews because it gives you more of an idea on what was actually performed in those exercise interventions. Now, to wrap it up, we look at all the research and we want to apply this to practice. Now, unfortunately, if you were expecting in this particular presentation me to give you an exact prescription guidelines on what to do with lupus patients, this isn't quite the case with this disease. We can only really go off the very few trials that have been done in systemic lupus and base our decision around that. So as a practitioner, we really need to read the research, but then think about how it's actually going to be applicable for people with lupus. So I broke it down very simplistic here for you based on the evidence that I've presented. So aerobic exercise has more of an effect in improving fatigue based on the findings. Intensity. Now, it didn't really talk about which intensity is better. We don't actually know that. But most of the studies, if you look at the exercise interventions, they were moderate intensity. High intensity exercise isn't quite explored in this population. If we look at time of exercise, most studies were about 8 to 12 weeks. Now, these are research studies, and of course, if you're working with patients, the aim is to work with them long term. So we know that if people keep at exercise on a regular basis, it will have more of an impact on improving their fatigue. Most of the studies looked at a duration of 30 to 50 minutes. Now, of course, that's going to be really individualized. Some people might not be able to sustain a full 30 minutes or 50 minutes. So again, you can always use your Australian Healthy Guidelines to help base your decision and use the 150 minutes per week as a guideline to how much exercise they should be doing, and do what's manageable for each person. Now, the setting in most of the studies, they looked at supervised exercise, and as I presented, a supervised exercise setting does help with improving fatigue better than home-based exercise. Now, if we think about why that's the case, we don't know if people are actually doing the exercises at home. We can only trust what they're saying. With supervised exercise, we can actually see and monitor the people doing the exercises safely and effectively. And also, there's an extra element of supervising someone with exercise, and that's the social aspect. So for somebody who's experiencing such a rare and debilitating disease, being supervised and working one-on-one or in a group setting is highly preferable. So this is just an overall guideline for you to take away from this presentation about the safety and effectiveness of exercise. And I also just want to point out that I didn't go through specific exercise tests for aerobic capacity or muscular strength and endurance. And the reason for that is there's no real specific tests that are indicated for systemic lupus. You can use your own knowledge on what strength or endurance exercises are useful for the individual at the time and what their goals are, and also with aerobic capacity. But if you look at the interventions, most use things like a 6-minute walk test, or they even did some protocols on the treadmill or the bike. So again, that's up to your discretion to find out what the most suitable exercise test is. And just lastly, here's a list of references. I've included the 2 systematic reviews on systemic lupus and exercise and a few other studies. I've also included the websites to go to find some of those outcomes. This is not an extensive list. I have a lot more references, so if you would like to get your hands on some more and you're not sure where to search, you're always welcome to send an email to me or your lecturer in charge, and I'm happy to give out some more references. Thanks for listening, and I'll see you in the next presentation.